Module 5, Hypertension. According to the third National Health and Nutrition Examination Survey, 29% of all U.S. adults age 18 years and older have a blood pressure over 140/90 or are taking medication for hypertension. The prevalence of hypertension is nearly equal for men and women. Among adults with hypertension, 78% are aware of their condition, 68% are treated with antihypertensive medication, and 64% achieve a blood pressure less than or equal to 140/90 with treatment. Hypertension alone is unlikely to cause sudden collapse. However, hypertension is a potent risk factor for the development of more serious cardiovascular disease, peripheral vascular disease, and chronic renal insufficiency. In individuals ranging from 40 to 89 years of age, for every 20 systolic or 10 diastolic increase in blood pressure, there is a doubling of mortality from both ischemic heart disease and stroke. The relationship between blood pressure and risk of a cardiovascular event is continuous, consistent, and independent of other risk factors. Both elevated systolic and diastolic blood pressure are risk factors for coronary heart disease. Once in the profession, commercial motor vehicle drivers have a greater propensity to develop hypertension than their peers in other professions. The Cardiovascular Advisory Panel Guidelines for the medical examination of commercial motor vehicle drivers includes data demonstrating that the percentage of drivers with hypertension increased from 29% in drivers with less than 10 years of driving experience to 32% in drivers with 10 to 20 years of experience and to 39% in drivers with greater than 20 years of driving experience. As the years of experience rise, part of the increase in hypertension may relate to accompanying aging, increase in body mass, or decline in physical activity. High blood pressure can be a modifiable cardiovascular disease risk factor. Lifestyle modification and pharmacotherapy are the mainstays of antihypertensive treatment regimens. Effective hypertension management reduces cardiovascular morbidity and mortality. The Chicago Heart Association Detection Project and Industry found that antihypertensive therapy reduces the incidence of stroke, MI, and heart failure. Contemporary medical therapies are effective in lowering blood pressure, reducing complications, and are generally considered safe. Regulation 49 CFR 391-41B6 states, "A person is physically qualified to drive a commercial motor vehicle if that person has no current clinical diagnosis of high blood pressure likely to interfere with his or her ability to operate a commercial motor vehicle safely." During the physical examination, you should ask the same questions as you would for any individual who is being assessed for high blood pressure or who carries a current clinical diagnosis of hypertension. A current diagnosis of hypertension exists when one or more antihypertensive agents are used to control high blood pressure. When antihypertensive medication is used to treat an underlying condition other than high blood pressure, certification is based on the underlying condition and tolerance to the medication. The FMCSA Medical Examination Report Form includes questions about the health history of the driver and requires measuring the blood pressure. Additional questions should be asked to supplement the information requested on the Medical Examination Report Form. You may ask about symptoms of hypertension and use of antihypertensive medications. It is generally not the role of the medical examiner to determine treatment for the disease. The driver completes the health history on the Medical Examination Report Form. Per regulations, you must review and discuss with the driver any yes or not sure answers. Does the driver have high blood pressure? Take antihypertensive medication? Information to obtain from the driver with hypertension includes symptoms related to or caused by high blood pressure, current limitations resulting from hypertension or its treatment, medications used to control hypertension, including dose and frequency, driver response to prescribed medications, side effects that might interfere with safe driving, lifestyle risk factors, particularly modifiable behaviors and conditions, for example, smoking, obesity, and lack of exercise. Per regulations, for every certification and recertification exam, you must measure the blood pressure and check pulse rate and rhythm. The 2024 FMCSA advisory criteria note that an elevated blood pressure finding, that is, a blood pressure over 139/89, should be confirmed by at least 2 subsequent measurements. record the additional blood pressure measurements in the second reading space or in the box to discuss abnormal answers in the physical examination section on the medical examination report form. The FMCSA states that only the blood pressure readings contained by the examiner during the initial or follow-up examinations should be used for certification decisions. This appears to preclude using the primary care physician's records to determine the blood pressure. Under the supervision of the medical examiner, trained assistive personnel may measure and record the blood pressure. However, it is prudent for the medical examiner to confirm disqualifying blood pressures personally. The blood pressure may vary, especially the systolic pressure, for a number of reasons: the circadian cycle, emotional and physical state, coffee and cigarettes within 30 minutes, stress, white coat syndrome, blood pressure difference between the left and right arms. Measurement techniques that can contribute to inaccurate blood pressure measurements include placement of blood pressure cuff over clothing, use of a blood pressure cuff too small for the individual's arm, positioning the arm incorrectly. The medical examiner does not determine treatment. The examiner determines the presence of hypertension and its stage, medical fitness for duty, and the length of the commercial motor vehicle driver's certification. The treating clinician is responsible for confirming the diagnosis, prescribing treatment, and determining the effectiveness of the treatment. We will now review the specific advisory criteria and FMCSA guidance in detail and explain it in simple terms. Expect questions regarding the 3 stages of hypertension on the NRCME examination. In November of 2017, the American College of Cardiology and the American Heart Association released updated guidelines for the detection and management of hypertension. These new guidelines created new blood pressure categories. Normal is defined as less than 120/80. Elevated is a systolic blood pressure between 120 and 129 with a diastolic less than 80. Stage 1 hypertension is 130/139/80/89, and Stage 2 is over 140/90. These new definitions replace the previously used 3 stages of hypertension with which we have become familiar. However, the Federal Motor Carrier Safety Administration has yet to update its definitions, and therefore, for the purposes of performing physical examinations on commercial motor vehicle drivers, the familiar 3 stages will continue to be used until such time that the FMCSA updates its definitions. There has been some indication that the FMCSA was considering updating its hypertension guidance to align with the current ACC/AHA standards. However, with the release of the 2024 Medical Advisory Criteria, the FMCSA affirms that the 3-stage definition remains in place for DOT exams. The 3 stages of hypertension are as follows. 140/159/90/99 is Stage 1 hypertension. 160/179/100/109 is Stage 2 hypertension. Greater than or equal to 180/110 is Stage 3 hypertension. When a blood pressure reading is a value where the individual systolic and diastolic readings are in different stages, you should classify the reading by the higher stage. So for example, 168/94 and 148/104 are both examples of Stage 2 hypertension. Stage 1 hypertension. Blood pressure greater than or equal to 140/90 and less than 160/100. Stage 1 hypertension is usually asymptomatic, and a blood pressure in this range is considered a low risk for hypertension-related acute incapacitation. However, all hypertensive drivers should be strongly encouraged to pursue consultation with a primary care provider to ensure appropriate therapy and healthcare education. If this is the first time the blood pressure has been elevated and there has been no prior blood pressure treatment, the driver with a blood pressure in this range is at low risk for hypertension-related acute incapacitation and may be medically certified to drive for 1 year. At 1 year, the driver has another complete certification examination. If the blood pressure is 139/89 or lower and the driver is taking antihypertensive medication, the driver receives a 1-year certificate. If, at 1 year, the driver with previously diagnosed Stage 1 hypertension is still Stage 1, the driver may receive a one-time 3-month certification. Advise the driver that failure to lower the blood pressure to below 140/90 will render the driver medically unqualified for continued certification. The driver with elevated blood pressure or hypertension should have at least an annual medical examination. When certified for 3 months, the driver is to seek possible initiation of drug therapy to lower the blood pressure to less than 140/90 to be recertified at follow-up examination. Stage 2 hypertension. Blood pressure greater than or equal to 160/100 and less than 180/110. Stage 2 hypertension is considered an absolute indication for antihypertensive drug therapy, and the driver should seek initiation or evaluation of therapy to lower blood pressure. Effective blood pressure management includes routine primary provider follow-up and periodic screens for the presence of target organ damage and clinical manifestations of cardiovascular disease. The driver is given a one-time certification for 3 months to allow time to reduce the blood pressure to less than 140/90. At the 3-month examination, if the treatment is well tolerated and the driver has a blood pressure of less than 140/90, the driver may be certified for 1 year. The driver is certified annually thereafter. Advise the driver issued a one-time 3-month certificate that, to qualify at follow-up, the blood pressure should be below 140/90. If the driver fails to lower the blood pressure by the expiration date of the one-time 3-month certificate, the driver will be disqualified until the blood pressure is less than 140/90 at examination. Stage 3 hypertension. Stage 3 hypertension carries a high risk for the development of acute hypertension-related symptoms that could impair judgment and driving ability. Acute manifestations of elevated blood pressure to this degree can include sudden stroke, acute pulmonary edema, subarachnoid hemorrhage, aortic dissection, and aortic aneurysm rupture. Meningismus, acute neurological deficits, abrupt onset of shortness of breath, or severe ripping back or chest pain could signal an impending hypertensive catastrophe that requires immediate cessation of driving and emergency medical care. Symptoms of hypertensive urgency, such as headache and nausea, are likely to be more subtle, subacute in onset, and more amenable to treatment than a hypertensive emergency. A driver with a blood pressure in this range is disqualified because of the high risk for an acute blood pressure-related event. The driver may not be certified to drive a commercial motor vehicle until the blood pressure is reduced to less than 140/90 and treatment is well tolerated. The driver with a history of stage 3 hypertension is recertified every 6 months if the blood pressure is less than 140/90 with treatment. Do not certify the driver if the driver is found on examination to have a blood pressure equal to stage 3 hypertension, regardless of history or treatment. To recap then, before the driver who is disqualified for stage 3 hypertension can be considered for recertification for a maximum of 6 months, the driver must, at examination, have a blood pressure less than 140/90 and treatment that is well tolerated. At future semi-annual examinations, if the blood pressure is equivalent to stage 1 or stage 2 hypertension, on a case-by-case basis, you can consider the use of a one-time 3-month certificate in accordance with stage 1 or stage 2 hypertension guidelines to allow the driver to obtain more effective treatment. The driver should have a medical examination every 6 months. There has been a good deal of confusion as to whether the one-time 3-month certificate is a lifetime or single episode guidance. A statement by the FMCSA indicated that this is guidance and would not prohibit an examiner from issuing another 3-month certification if the examiner believes the medical condition does not prohibit driving but does require more frequent monitoring. The medical examiner may recommend an evaluation for secondary hypertension by the driver's primary clinician or specialist. The medical examiner may recommend an evaluation for secondary hypertension by the driver's primary clinician or specialist. The medical examiner needs to consider the possibility of secondary hypertension based on the history and examination findings, particularly in a patient with refractory hypertension, for example, the individual taking 3 or more antihypertensive medications. Examples of primary conditions that may lead to secondary hypertension include pheochromocytoma, primary aldosteronism, renal vascular disease, and unilateral renal parenchymal disease. Some cases of secondary hypertension may be amenable to surgical intervention. The minimum waiting period for applying for commercial motor vehicle certification is 3 months after surgical correction, and the maximum certification period is 1 year. The clinical course for non-surgically treated secondary hypertension is based on the primary hypertension guidelines. Using current FMCSA guidelines, what is the maximum certification period for an interstate commercial motor vehicle driver with stage 1 hypertension? The maximum certification is 1 year. Using current FMCSA guidelines, what is the proper determination for an interstate commercial motor vehicle driver with a diagnosis of hypertension who presents with a confirmed blood pressure of 182/112? A commercial motor vehicle driver with stage 3 hypertension should be immediately disqualified until the blood pressure is controlled below 140/90. The driver presents an unacceptable risk for an acute hypertensive event that endangers the safety and health of the driver and the public. Using current FMCSA guidelines, what is the maximum period of certification for a driver previously disqualified for stage 3 hypertension, but who has, at the certification examination, a blood pressure of less than 140/90? 6-month certification if the driver also tolerates medications with no side effects that interfere with driving ability. A driver is noted to have a blood pressure of 145/90. How should the medical examiner proceed? A blood pressure of 145/90 should be confirmed with a second reading during the examination. If the second reading is less than 140/90, the medical examiner may choose to certify for up to 2 years if the driver is not taking antihypertensive medications. If the driver is taking antihypertensive medications, 1 year would then be the maximum certification period. If the second reading is greater than 140/90, the medical examiner should use stage 1 guidance for certification. This concludes Module 5, Hypertension.